Palliative care is the care of people who have been diagnosed with a life-limiting or a life-threatening illness. Palliative care is not just the care of people's physical symptoms, it's about their emotional, social, psychological well-being, and also looks after their families or who they see as their families. The team that looks after people with palliative care can be nurses, doctors, social workers, carers, and GPs. Traditionally, we've looked after people with cancer in palliative care, but treatments have got really sophisticated and people are living longer with their cancers. But we've also got people living longer with other health conditions and multiple comorbidities. So that's where now palliative care really sees a role in looking after people, not just at the end of life, but as they get diagnosed with multiple disease processes. There's really 4 clear sort of defined stages of palliative care. People can be stable, so their symptoms, be that physical, emotional, psychological, are stable. We can engage with those people at the first diagnosis, really. An unstable phase then is someone who is having perhaps 1 or 2 symptoms and is starting to have some impact on their daily life with the symptoms from their disease process. The deteriorating phase is where we see a gradual decline in people's health. It's impacting on their daily lives. We need to manage symptoms quickly, and we start to involve more people as part of the team. The actively dying phase is where someone's life can be measured in hours to days. People are having more symptoms, they're often less awake, more time in bed, and we need to manage their symptoms. We need to focus on quality of life, not quantity of life, and that requires constant and regular checking of their symptoms, making sure that they are comfortable and making sure that their families are fully informed of what is happening. The bereavement stage is the final stage of what we look at in palliative care phases, and that's very much about the family or what the person saw as their family, and really supporting them up to 6 weeks after someone has passed away. Early intervention in palliative care is really important. It helps us support patients early and rigorously so that their symptoms are very well managed. Dying is not a crisis. It should not be seen as a crisis. Life is 100% mortality rate. We are all going to die. We need to be prepared for someone's end of life as early as possible. Additionally, early intervention gives health professionals the opportunity to really understand the cultural and religious beliefs of individual people. That helps us tailor-make our care to that person and their family. There's a lot of myths and misconceptions about palliative care. Often patients and their family and even some health professionals think palliative care is only called in as someone is taking their last breaths. Palliative care is, as I said before, very much about early intervention. We are much more effective the earlier we are brought into a patient's journey. Waiting for someone to declare someone as palliative or as they're dying is way too late. It does not give us, as health professionals, the opportunity to manage their symptoms, their pain, their breathlessness, their psychological distress, and also support their family. By adopting a palliative care approach in aged care and seeing palliative care as core business in aged care, we are focused then on the person, giving them the best end of life experience that we can possibly give them.